Okay, well, welcome everyone. I am super excited about today for our webinar, Utah Legislative Wrap-Up and Federal Forecast. We are so excited to have our two guests today, our two presenters. You're really in for a treat. Our presenters today are not only trailblazers, but experts in today's topic, and everyone in the special needs community has benefited from their passion and hard work. Janet Wade and Gina Pulmoney are on the board of LCPD, which is Utah Legislative Coalition for People with Disabilities. As many things in life, the work, the risk-taking, and the dedication of a few have made life better for many. There exists today a whole wide array of services for people with disabilities. These services have emerged because of grassroots advocacy by people with disabilities, their families, friends, and caring professionals. The results of advocacy have been encouraging in the past 40 years, but the battles guaranteeing the rights of individuals with disabilities are far from over. Since its inception in 1981, the coalition has successfully advocated for progressive changes for people with disabilities. The LCPD is made up of individuals with disabilities, their families, advocacy groups, providers, professionals, and agencies. You do not need expertise in advocacy work to be involved. Advocacy means to speak up, to plead the case of another, or to champion the cause. The LCPD makes being an advocate easier by providing a network of support, experience, training, and dividing responsibility to enable advocates to focus on their energies on a single issue. LCPD meets on the first Thursday of each month at 12:30 p.m. via Zoom and on Mondays during the state legislative sessions. So today we are recording and we will put questions in the chat box, and Janet is going to be watching the questions, and I'm going to turn the time over to Gina. I'll let Gina and Janet both talk a little bit about their expertise and the things that they do for our community. Thank you, ladies.
Janet, do you want to introduce yourself?
Okay. I'm Janet Wade. A previous life, I ran services for Easter Seals Goodwill. I have a Provo early intervention program down in Provo, and programs for teens and young children with sensory issues. So I failed at retirement and went back to work for Utah State, coaching early childhood providers in strategies to support children with challenging behaviors. So I can't seem to keep away, but hand it over to Gina, who really is the expert and is going to do the bulk of this presentation.
Okay. That's gonna, so you can see that still, right? I don't know. Okay. All right, I'm Gina Pulmoney, and like Janet, I retired about 5 years ago from about 30 plus years of working at the state level, a federal contractor, as well as the associate director for the Utah Parent Center and the founder of Utah Family Voices. And so I thought, okay, it's time, not because of age per se, because of continuing family needs and such. But I didn't do very well either. Part of that is because we still needed health insurance. So I went back to work at the University of Utah, and currently, and still, actually, I was a contractor for the university, and they pulled that back and helped make a part-time and now a full-time position for me to continue my leadership education training for practicing professionals, as well as being a study coordinator for research project for autism. So very much enjoy what I do. Janet and I both do serve with some other wonderful people on the Legislative Coalition for People with Disabilities Leadership Board. And it's all volunteer. There is no paid time. We try to fundraise when we can, and that's mainly for our annual reception. So To kick this off, I just wanted to say we're trying to respond to some of what was asked, and that is the 2025 legislative wrap-up. I didn't know if there was a question. As well as some of the federal issues that we're all seeing and having anxiety about, and then let you know there are actions we can all take to educate decision makers and policymakers. Give you a few information sites and resources, and just remember, it's you. You're the expert. You make the difference. So, which was alluded to, we are a 501c3 organization that was started in 1981. And actually, one of the founding members is participating today. Thanks, Jan, for being here. But we advocate for public policies that affect all individuals with disabilities in Utah. And the membership is open to everyone, and that includes both voting and non-voting members. And what that means is voting members are typically those self-advocates, individuals with disabilities, families of children with disabilities and special health care needs. Non-voting members are usually those that are working with state agencies and are usually on work time. So they are not voting members, but they are welcome to come. And we actually enjoy when they do because they can give us more current information. The LCPD, which is how I'll say it from now on, since it's a long name, is nonpartisan. We truly want to just help everybody because, again, everybody is different and their needs are unique to their family. So they are the experts on that. And we just want to give information about what's going on and help with any needs for advocacy during the legislative session as well as year round. So the basic advocacy, I just have to say this because a lot of people think, well, who am I? Well, your potential influence is far more significant than you think. And speaking up, of course, will not guarantee a win, but not speaking up guarantees that your specific information won't be known. The only way that our policymakers can know what's going on is to hear from the people that are actually at that grassroots level. And your only task is to be yourself, a citizen and a voter who wants programs and policies to work for those who desperately need them, including your family. So real quick, this is my overview and I just picked out a series of different things that happened. Of course, there was a lot more, and towards the end, we can show you how to find those, but I'm just going to do a real quick overview of some of the things that happened, whether it was good, bad, or maybe it depends because people have different needs and philosophies, so we put a few in there. So the good, Senator Escamilla had this bill, Senate Bill 170 for school discipline amendments. And what's great about that is it really starts to define seclusion and, what they can do for behaviors and such. And so as reading through the bill, I thought that it was a great bill to get passed and help actually protect our students and children that may have been secluded or restrained. So a good bill that passed. And then also House Bill 334, which was the guardianship and supported decision-making amendments by Representative Abbott. And Janet will actually probably talk a little bit more about this a little bit later to show the involvement. But this was a good one because it's been the second year that it has really been worked on a lot, and two different sides come together to make, to kind of come in the middle and say, okay, this is what we need as individuals, with disabilities that want to, of course, direct their life and all those decisions, but as well as the guardianship for those that have adult children that may need a little bit more support and such. So it was a really good bill with a lot of work from not only the representative, but community members, stakeholders, and Janet. And then we also had House Bill 310, the disability coverage amendments by Representative Daley Provost, and it passed. And I really, really like this one. It was not covered as much as I would have liked to seen, but this is really for our children with disabilities as they transition into adulthood. And if they want, if they're making money, they've gone to college or whatever, this is for those that work and really need, even if their job offers insurance, really still need that wraparound or comprehensive coverage that Medicaid affords us, because we know that typical insurance policies don't even come close to meeting like the therapy needs and all of that, or the medications and such. So this was a really good one because the limits are pretty high for somebody with a disability to be able to work and still have that wraparound coverage. And then Senate Bill 146, the glycogen amendments from Senator Plum, that also passed, which I guess hadn't realized this in the past, but in schools, if somebody was, and I want to make sure I say it right, had an emergency because of the being hypoglycemic, which can be very life-threatening. So this is part of another bill, but it did get passed that schools can now give this, in some cases, life-saving treatment and have it on hand at the schools to help for individuals that deal with diabetes and have some of these complications. So those were actually really good. There was bad, of course. Well, the bad, even though I have Senate Bill 257, a lot of us heard about this. This was Brammer's bill, and it failed, thank goodness, but it was a bad bill. It's going to come back, unfortunately. And this is really about if the state has a shortfall for any reason and such, then they start looking at Medicaid to make up for those shortfalls. And that could be through a number of ways: block grants, capping Medicaid, reducing optional services, which for many of us that have disabilities or have family loved ones with disabilities, they're not optional. They are actually needed. But in the language of Medicaid state plans and such, a lot of the things we desperately need are considered optional. And then I know this one I probably should have put in the it depends, because people are torn on this, and I put it in here because I highly believe that fluoride in the water helps a lot of children, especially children with disabilities, not get that early decay and caries, which is very painful and such. But I do recognize others have gotten information that fluoride could be dangerous. So I don't want to lead you one way or another. I put it because that was my stance, but you may have a different stance, and so it should really be in the it depends. And then House Bill 281, the Health Curriculum and Procedures Amendment, also passed. And I think this is bad because it is basically telling the mental health professionals in schools, whether they're school psychologists or what, that they have to get approval from the parents on what they talk to that student about. And, many would say, well, yeah, I kind of want to know. But at the same time, that makes it also, if there is some needs that that student needs to talk to, an objective person that can help them figure things out, that kind of takes away that security for the student. And then there has to be, so this is, time-wise, there has to be a full written report of what they talked about in those sessions. And then even healthcare pieces, unless it's an emergency in a dire situation, again, things need to be passed by the parents first, which again, I agree with, but I think it's a slippery slope because of how many students we have that have special health care needs and such. So anyways, that one did pass. Homeschool amendments also passed. The reason why I put this on the bad is because no longer do those parents have to pass any background checks. And yes, parents have, full authority to decide, for their children of, how and what they want to learn. But at the same time, we do need those essential skills, which is math, reading, writing, and arithmetic. The other thing that concerns me about this one, if there is no checking, we've seen on the news quite a few times, that's awful. There's no, I guess, checks and balances to make sure that those children are safe, healthy, and not being mistreated. So that one I think needs some work going forward. The pharmacy accessibility amendments, it failed, which is very disappointing because it was basically saying that those individuals that are blind, they need to know what they're taking. So really looking at having those medications have Braille or something, a way for individuals to read them and know, but unfortunately that failed. And then maternal and infant amendments, it passed. This one's concerning because again, parents have rights, but we've all been brought up with when we have a baby, we get that, heel stick, and it screens for, life limiting or life altering diseases and such that if found, at birth, then they can remedy that on most cases. And so now it's pretty much an opt-in, which I think many newborns are going to get missed. And the one thing that it had said in the bill that they had to, be given a 24-hour notice before they could get that blood spot. Luckily, that was, I guess, taken out with some insight from our Department of Health and Human Services. Most moms and infants are not in the hospital anymore for 24 hours. So you have a missed opportunity. So luckily, they did come to a compromise on that. And then the amendments to election law passed, which at the moment is not going to make huge differences because they were really trying to get that you had to vote in person and a lot of different things. It is, I'm not going to go too much into it. It will be more and more each year, but for now, they're saying that, they still want to help those individuals with disabilities, the elderly, rural populations be able to vote by mail. So keep an eye on that one. All of these are, Janet will talk quickly in a second about the website. You can find out more information if any of these you want to know more about. That it depends. The guardianship amendments passed. This was on top of the supported decision-making and guardianship. This one is talking about those that have severe intellectual disabilities, that they don't have to go through the whole process and have, go to court to continue doing that as well. It also it exempts a person with severe intellectual disabilities subject to a guardianship from the substantive provisions in Guardianship Bill of Rights. And basically, there are some issues with this. And again, it's all about want to make sure that individual with disabilities is getting the proper treatment and is okay. So just some checks and balances again. So it's good for some, but we do need some checks and balances. And then the House Bill 455, Utah Fits All Scholarship Program Amendments. This one's very interesting for the fact that it's a good thing for some because it gets messed up, which is unfortunate with the Carson Smith Scholarship for Special Needs. This one is for anybody and everybody. And it's hard because it really takes that weighted pupil unit, which is what helps fund school districts. It gives that to those in private schools or homeschool based. And the problem is that most families, when signing up for it and then going into it, don't realize if they have a child with special needs, they don't have to follow any IDEA or, do an IEP. That's all out the window once it's private. So the other concern is about budgets, is that money has been allocated to wherever that may go. The school district loses out on that, but the school district has to take them back if the family decides that, yeah, it's not meant for them because they need more resources and related services than can be offered elsewhere. So that one is unfortunate because I don't think there's not a great transparency about how the millions of dollars have already been spent. So it's good for those that need it. It's bad for those that don't understand it and could really get delayed because some of the services and related services and needs are not being met. So just appropriations, the Carson Smith Scholarship got $4 million ongoing. Our DSPD waiting list, it was twice the amount that was asked for, and we got half of that. So it's $6 million in ongoing. This $6 million is for the wait list, of course, but it also, if you don't know the difference, there is a limited supports, and then of course the community supports, as well as it will fund some peer support for those on the waiting list. Baby Watch Early Intervention only got 1.5 million one time, which will unfortunately not help their caseloads at all. So that will be something that will need to be looked at in the future. And then there's a mandated additional needs for those that are already on DSPD. And so they got 11.2 million ongoing. Camp Costopolis got 600,000 one-time money for recreational therapy and respite. So any of you that are looking at that, check out Camp K. The Children's Center got 200,000 one time, and an additional mobile crisis outreach team unit for those that are in crisis mental health wise. So there will be an additional team that can go out, 1.1 million ongoing, which is awesome. The Utah Autism Academy got 1 million one time. See, these are just worth noting real quick, is that there is an RFP, a request for proposal out there for a study on barriers to mental health treatment for children, which is huge because we know mental health is on the rise. For those with disabilities, especially developmental disabilities, finding providers that treat mental health as well as their co-occurring disability is very tough. And then House Bill 257 requires a health insurance plan, which this is really good, to give an enrollee their portion of a drug rebate and use it to reduce out-of-pocket costs or enhance their benefit. That is a really good bill that was passed. And then Senate Bill 171, it creates a youth defense fund to pay for an attorney for a youth referred to juvenile justice system. This is important because many of our children that end up in juvenile justice system do have underlying disabilities, whether that's autism or fetal alcohol. So I was pleased to see that had passed. And House Bill 100 establishes a program to provide free lunch to eligible students, as we always see here in the news how much debt students have. So they've defined the criteria and really try to help those, because we know sometimes that many of these students, that's their only nutrition for the day. House Bill 129 allows an adopted individual to access records associated with the individual's adoption if that individual is 18. Some of our federal policies, which is kind of what we've all been hearing in the news. I'm going to give you a few other options. We do know that you've seen a lot that says contact your, congressional representatives. So your senators and your representatives at the national level. Still agree with that. We're going to talk about that more in a minute. I encourage it, and we're going to talk about how to do that. But there's another way in having your voice heard, and it's because all federal policies have to go through a notice of proposed rulemaking. Well, they used to. I'm not sure how well it's being enforced right now. But an agency can initiate a rulemaking activity and adds an entry to its regulatory agenda. And then a proposed rule or other document is published on regulations.gov. The public is allowed to comment on this rule for a specified time frame. And the final rules can be accessed also on that regulations.gov. So public comment, how do you do that? Well, the proposed rules or regulations will be posted in the Federal Register, which is federalregister.gov. And this typically allows 30 to 60 days for public comment. The public comment, and why I want to emphasize this piece as well as contacting your representatives, is the commenting helps decision makers determine the level of public acceptance or resistance, allowing them to respond to people's needs, grievances, and preferences. And commenting ensures that on-the-ground experiences are taken into account. And you may be personally affected by this issue or work with affected people. So share this important perspective. And your comments are important for potential litigation. Even if they do not change the regulation, your comments help create the administrative record that a federal agency or decision maker has to consider when finalizing a rule or regulation. So I would get on this, the Federal Register, and see if there's anything that particularly, pertains to your family and such, and look and see if the public comment is open. Okay, Janet, I'm going to let you go through the best practices in policy.
Okay, well, thank you, Gina. That was a lot to go through. So very quickly, because we don't have much time, the most important thing is what Gina said at the beginning, is you are the best person to know about your issue with your child or with your relative or with your community if you have a concern in the community. We don't need to always speak for ourselves. We can speak also and support the neighbor down the street. And when communities come together, that's when good things happen. So the first thing you need to do now is the time. The time during the legislative session is not the time to build relationships. Now is the time to build relationships with your legislature. I have put in the slideshow, there's some links where you can go to find out who your legislator is. le.utah.gov is the landing place to go. That's where the calendar is. That's where you see what is going on. But from there, you can find a map to your district if you don't know what your district is. Also in the slideshow further down, we'll come to a list I put together. I was thinking because United Angels is in Utah County, it was all Utah County folks coming on this call. So I didn't realize there'd be other people. So I apologize. But I know there's a lot of legislators in Utah County, but I was shocked to find there are 20. And there isn't much, there's no choice in Utah County, just put it that way. But as Gina said, we're nonpartisan, and I work with everybody in the legislature because usually a legislator does have a relative or somebody they know who has a disability. And I found the legislators have, on the whole, been very open to working with us and listening. You are the expert. So if you can build that relationship and your legislator sees an issue coming on the floor that is a bill about disabilities, have that strong relationship so they can call you and say, do you know about this? How does this affect you? That is so important. learn as much as possible, but if it's your issue, you know because it's impacting you. The biggest thing is to be respectful. Building that relationship means we're not going to call them up and start attacking them or email them and say, I don't like what you're doing. Always, because they have been kind to disability issues on the whole, especially the wait list, start off with thank you. They don't often hear thank you. So it's really good to say, start off, especially looking at this session. Thank you so much for passing the $6 million for the DSP waitlist. That means such a lot. If you have an example of somebody who's now gone into services, that's great to bring in. But that opens the conversation and starts building that relationship. I do want to, do you want to do the next slide? Okay, so this next slide is just a list. And so I think if Carrie can, if she has your contact information, can send this out. But I made a list of all Utah County legislators, their position, if they're chairs of committees, what committees they're on, their emails, so you can email them, and always put, I am a constituent in your district in the top line, because then they'll open the email. In that subject line, you can even put your zip code so they know that you are in the district. And I also put the district numbers in down the side to hopefully help it easier for you to find your legislature. Let me talk a little bit about how we got bills passed or how we supported. The supported decision-making bill was really a fine example of legislation at work. We met every month with Representative Abbott. I went to as many of those meetings as I could. 2 members of the leadership team who are experts, not only experts on the law, but experts because they have adult children with severe intellectual disabilities. We had support coordinators and we had others who were interested. And we met, and we had the Disability Law Center there too. So the goal was to ensure that people with disabilities do have a voice in their own life, but also that protections are in place, because it's very scary for parents who are guardians, that this, you know, it's very scary that their child might be, or young adult might be taken advantage of. So we had to make sure those protections were in place, and we worked for a whole year to do that, and everybody came to consensus. So that bill passed at 11:59. So it only just got brought back to the floor. It was touch and go. I also want to say about the guardianship amendment bill. Again, we had 2 people from the coalition who were actually working independently. So you can be on the coalition and work with the coalition, and that doesn't stop you from doing your own advocacy either. And that bill, I know they are going to do a lot more training on what this means and put a lot more protections in place, because that was the worry, that there weren't protections. We hope, and we know, all the people we know who are guardians are really good people, but that might not be the case all over the state. And so we need to make sure that there are protections in place, and there is going to be a lot of training for the courts, working with the courts on that, making sure there are court visitors, and just making sure that the protections in place. And so lastly, I want to say how we supported the DSP wait list. So there were the peer-to-peer program had some separate money. There was a $6 million for the wait list, and then Representative, and her name has just gone out of my head, came in with a I think it was about a $5 million ask for another piece of services for people with disabilities. And that sometimes happens. So that kind of put the number up to 12 million, which is a huge number. And so sometimes what happens, that happens not on accident. They didn't know what they were doing. It comes in to show, oh my gosh, 12 million. Oh, we can't do that. That's a lot. Let's put it down to 6 million. So in the end, basically what I'm saying, we got the 6 million, which was the original ask. So there's a lot of backroom shenanigans goes on in there. And you've just got to try and kind of walk through the weeds. But the reason why this passed was one of the reasons. We had probably hundreds of people writing letters to their own legislators, especially the legislators on the Social Services Appropriations Committee. And then we had, Gina talked a little bit about public comment. They've cut it off now. You can only do public comment on 2 Fridays. That's all. It used to be every day, but 2 Fridays. First Friday, we had 3 parents who spoke magnificently and captured just the passion and the emotion and what it's like to be a parent with a child with severe needs. And the chair of the committee had a it was stand up and acknowledged her. So that is telling your story, and that's what is so important. So important to have an issue, not to be broad in what you're saying, but have a specific issue. And this parent really spoke from the heart about life, day to day, you know, supporting a child with severe disabilities. And the second public comment time, we also had 2 parents speak, and the letters supporting it. So, you know, if nobody had been there, I really doubt that we would have got 6 million. So you are really, really important. There is, as I said, there is a district map on there, and then you can also find just your, when you know your district, you can look up the district, because sometimes the district maps are a bit broad and vague. But you know, you just have to spend a little time on that website and you'll find it. I think that's it, Gina. I think I've addressed most of the bills you said I would.
Well, or anything else. I think one important thing, Jana, about especially the wait list is, you know, even in the governor's budget, he had it at a lot more. And why it ended up coming in at 6 million, much lower than what everybody was anticipating, was because the revenue from the state.
Yeah.
Really low. So then all of their top priorities had to all of a sudden be reshuffled. And so the fact that the waiting list still was at the top is very encouraging to show that those legislators on, you know, both Democrats and Republicans value Medicaid and people with disabilities in their efforts to continue to try to help people gain access to Medicaid waivers. So that in itself is great to watch, you know, kind of look at the overall and the writing on the wall, that we do really have some great legislators on both sides that really, really believe in Medicaid and services for individuals with disabilities.
Yeah.
So, oh, sorry.
Sorry, Gina. I'm sorry, I forgot what I was going to say now. Carry on.
Okay, when you remember, just interrupt me.
Okay.
So I've just kind of put these resources for public comment. The first few are for the federal that I kind of talked about. So other than contacting, you know, your representatives for Utah and in DC, continue to do that. Be specific, be kind. We did hear from one of our trusted senators, and he's Republican, and he just said, please, when you're reaching out, you can be upset, tell us why you're upset, but give them specifics, and just instead of just say, do your job and we're so angry at you. You can still put that, but explain why. And in whether it's fears or whether we all know what our family needs and depends on, and that has to do with education and healthcare, including mental health. So the last three are things that many people don't know. There is actually public comment. In Utah, we have a public meeting notice that all meetings, there are a few that are not open, but they have to be transparent. So I've put some links there that you can kind of look at to see, you can get as much information as you want to educate yourself. Even though you know your own issue, it's kind of nice to see what others are saying about the same issue, including some of the best information is from those that are opposing it, to try to understand why, because then your education can help either educate them or at least where your opposition is.
So we have a chat. Kristen asked about the guardianship bill, if it will affect people with full guardianship. So the guardianship amendments is for those people with full guardianship, and that is the really strong protection for those wards. So they supported decision making. I believe that there is grandfather period in that. If you want to know more about guardianship and the guardianship bill, Lisa Thornton is the person to ask. She's an expert. She's a guardianship lawyer, and she also worked on this bill. So she's a really good person to ask. And if you email me, I can pass your question on if you want to put your email in the chat. I just want to say too, during the session, as Gina said, the revenues were low. So it was really hard to get anything passed because there was not a lot of money. And there were a few, every year there's always new legislators on the Social Services Appropriations Committee. It's really important, if they're in your district, to reach out to them, because there were about 3 new legislators and they had no understanding of a lot of the programs for people with disabilities. One had no idea what early intervention was. So how are they going to vote and support it if they don't know what it is? So it's really vital that you reach out. If one of your legislators is on Social Services Committee, start making that relationship now.
Thanks, Jana. These are just for your information. I do know that all of us are wishing that we would have paid better attention in school to our civics classes to say, how can they do these and such? But there is the Utah Civics Project. I put their logo on there because there's another one that is, I think it's got the same name. I put the link to the Facebook one. If you have social media, if you don't do Facebook, they are on Instagram. I looked, they do have a website. I'm hoping it's under construction because I get an error. So hopefully, but this is a wonderful, they're nonpartisan way to look at some things that are happening. They explain certain things. And then also this is a nonpartisan, it's betterutah.institute.org. They have and I didn't sign up, so I can't say whether there's a fee or if it's free, but they have little modules to understand, everything that's going on. So I just put that in there just for more information, because I do know right now what everybody's concerned about. We've gotten through our legislative session. We are very much more worried about what's happening at the federal right now. So I really wanted to kind of respond to what your questions were. So it's like, where are some of those sources to get some great information that, it's really about disability? My number one pick is the ARC of United States. And I've got that link there. They keep up with Medicaid education, and they are a full-fledged advocacy group. So they're helping to know what's going on minute by minute. So I would sign up to follow them or get their emails. I get their emails and I get a lot of information. The other thing that I found that was very helpful.
Stop you a minute. We have just a question in the chat. Can we just go there before we miss it? Does the increased income max include SSDI? And will the change in income limits affect spend down?
So the increase in income is just for Medicaid. It does not deal with Social Security.
Thank you.
There is it's transparent.utah.gov. I really am a data geek, and this is a place if you want to see what salaries are of some of our leaders, where the money is going for a lot of our state agencies, on and on. This is the website, and it's put out by utah.gov. So if you want to dig in to really see where your taxpayer dollars are going, it's a great place. And then to also understand, because I think part of the negative media is all about fraud, waste, and abuse. We all want to be more sufficient, but unfortunately, the portrayal of fraud and abuse is not accurate. But yet, so that's why I say get your facts, get the data for yourself. And in one of the previous slides, you can do advocacy at what level you're comfortable with. I hear from organizations all the time, you have to do this. You make sure you do what is best for you, but whatever that is, whether it's an email, whether it's a voicemail to, whoever, it's just important that they hear your voice, because again, they don't know there's an issue if you're not letting them know. So do it on your terms, do what's comfortable. Just make your voice heard in whatever way you can.
And
so I thought this was good. Can I just finish the last two slides and then we'll answer questions real quick?
Okay, yeah, I was just going to add though, if you do feel that you want to testify, we will help you do that. So through the Legislative Coalition, and we meet you, we take you to the room, and we help you with your testimony. So you're not alone.
And that's the state legislative session.
The state legislature.
So that's what's getting kind of confused is everybody's kind of looking at the federal right now.
Yeah.
And so during session, but even during this part, if you have something that you want to say and you're not quite sure about it, email Jana or I, and we will definitely help. Because Janet has been a phenomenal help to families and organizations and agencies in really helping to get that message across that really helps our lawmakers and policymakers understand, where the parents are coming from. So, utilize us as a resource if needed. This one, we always talk about year-round advocacy because we know that interim's coming up, and then, the agencies have their funding priorities coming in the summer. But this was great from Lily Tomlin. I always wondered why somebody doesn't do something about that. Then I realized I was somebody. And I think that's where I say it's whatever helps just to get your story out and whatever your comfort level is. So here is our website and our email, and then also Janet and I's other emails so that you can get a hold of us with whatever. And I will also get Carrie a copy of these to you as well. And then Is there, and I'm going to let Jana fill in any blanks and then, any questions. So thank you for bearing with us, rumbling through, because I think I'm hoping we've given you some tools and information on both the state level and the national level. Even on that state level contacts, Janet, doesn't it? It gives them their federal, right, as well?
No, I just put the Utah State on that contact list. I just did Utah County.
Oh, no, not that one,
No.
on le.gov.
Oh, LE.gov, yeah, yeah. So,
Yeah.
so just to remind people, the website for LCPD is on there on the last slide, and you'll get these. And if you go on there, you can sign up as a member, and then you will get sent reminders of when meetings are. So,
And the minutes,
the agenda and the minutes.
if you can't attend those meetings. So,
And also, we are looking for people to be on our committees. So we have a Children's Health Committee, an Adult Services Committee, Mental Health and Education. And we would love some new younger families to be on those committees. You'll have our support from the older folks on there, but it's a great way to learn is by doing, right? So we hopefully will see you and have you come to our next meeting and maybe sign up for a committee.
Absolutely. And you guys, I've been attending LCPD meetings for a couple of years now. And at first I was so overwhelmed. I had no idea even where to start. And they make it so easy to teach us how to become advocates for our families and to understand what is going on the legislative level. Just a reminder again that their meetings are every first Thursday via Zoom, and it's at 12:30. If you sign up, it is free. They'll send you the link, and then you can kind of just check it out and see and see how informative and exciting it is. And without people like Janet and Gina, we would not have access to the things that we have right now. So we need to keep that momentum going. There's a lot of scary things going on, and we need to voice our concerns and share our stories. I did want to share one thing. Excuse me, I'm so sorry. We had several members not understand how Medicaid, what it does in as far as what we're doing and the special needs community. If the federal government does put, I think it's 67%, and then the state has to match 33% into any of our waivers or any of our programs. And so it is important. Medicaid is important. A lot of people think it's just for low income families, but it services our special needs community. It services in our schools. It's what pays for reduced food. It pays for mental health services. It pays for our OT, PT, speech therapies. It does the waiver, the DSPD waiver. I know some people thought that was just paid for by the state. It is not. It is also through the federal government. So it's important for us to know what's going on and to become advocates for our families, whether that means sending off a letter. And one example that they gave us was to put most of the information in your subject line, like this is what it's about, like what my family is, and put a picture in it. Don't make it long. Don't make it a novel for them to read. Just like 3-4 sentences. This is my family. This is what we're going through. This is why this is important. Thank you for your time. And then because they're not going to read a novel, even though we have a lot to share, and we all have a history and many things that we could say that plead our case. But Janet, Gina, thank you so much. Do you have any last words?
No, Carrie, I'm glad you did that, because part of the scare is about, the reduction in Medicare, Medicaid, and Social Security. Yes, it's out there that they are going to cut by, the billions, and everybody said they can't do that without touching that. The problem is everybody's responding to that. There is nothing out there yet. So responding in a negative manner right now isn't helpful. It's more about, like you said, not all of the history and the details, the quick to the point, because I read the first few lines and why it's so important. But I am feeling better that a lot of our Republican representatives are against any cuts to those programs. So with education, we just need to watch and see where the, IDEA, special needs, all of that shows up, and then, mobilize around that. But right now, we're just trying, we're like everybody else. We don't want to put anything out there because there's so much misinformation. So I would say make sure you have trusted sources. And thank you so much for inviting us. And if you have Medicaid questions, that's where my passion is. And Carrie, sorry, I didn't see that it was yours. It's that increase is for individuals working, and they have to try to get a waiver from CMS to do that. So it's going to be a long road for that, but at least it passed.
Well, I can second that Gina is the Medicaid specialist. So if you have any questions, please reach out to her. Janet, just one more thing. I read, were you the one that sent out the letter from our reps to our senators yesterday? Oh, no. Okay. There is a letter that was sent out yesterday that was very encouraging. It was Utah reps sending to our senators, just telling them how important it is to protect Medicaid, that it is something that that we're, as Utah, as the state of Utah, we are one of the lowest using in Medicaid, but that the services that Medicaid provides are so important to our families and the state in general. So if you want to look that up, it was an article that went out, and it talks about how they are advocating for us.
And the New York Times had an article yesterday about Medicaid. I couldn't read it, but that Medicaid isn't just for health. But, a lot of people don't know that early intervention, the Part C birth to 3 program that a lot of your children probably started in, that for those low income families, that Medicaid pays a special rate for those families. And without that special rate, early intervention programs would find it very hard to be in business. Yeah. Because the legislators made them put a sliding scale fee in for, people over the Medicaid income level, that would not at all cover the cost of doing business. So that is really scary. So it's not only the services, it's the services for people, but the providers providing those services, they will not be able to provide those services without that Medicaid funding.
I was wondering about primary children's, because they said, I think it's about 80% of their patients are on Medicaid. And so, I mean, are we going to have the medical care that we need, the advances in medical care that we need? Also, I know for myself, it took me several years to figure out why I was signing something at my IEP about Medicaid, because I'm like, I don't have Medicaid. Medicaid paid for my daughter's OT, PT, speech. Right. So if you think you're not using Medicaid, you are. And so it is a huge, it's a huge benefit to our community. And without it, we would not be where we are with our kids being able to be out in the community and have the experiences that they have. So thank you guys, everyone. Does anybody else have any questions? Okay. Well, thank you, ladies. We appreciate your experience, your passion, and everything that you've done for our community. And I hope to see some of you at LCPD. It really is, you do not have to get on a committee. You can just watch it and see what happens at first. And then maybe you can help out in ways, whether it's reaching out to your legislators and sharing your story, or maybe some resources. But thank you guys all, and have a good afternoon.
Thank you.
Thank you.